Hi, today's topic of discussion is types of local anesthetics. Coming to the types, there are three major types of local anesthetics which are given as infiltration anesthesia, surface anesthesia, and regional anesthesia. The first type of local anesthetic is infiltration anesthesia. So, this infiltration anesthesia is nothing but we will administer a local anesthetic into the area where that particular which area is required to be getting anesthetized. Usually this method is preferred for the maxilla, which is an upper jaw. So we will uptake local anesthetic of 0.5 to 1 ml, which will cause the anesthesia of the particular area or the region. So what is our objective for this infiltration anesthesia is nothing but we will deposit the local anesthetic as close as possible to the apex of a tooth, where which tooth needs the anesthesia, which region of a teeth requires anesthesia. In that particular region we will deposit this local anesthesia. As we are depositing the local anesthetic, we call it as infiltration anesthesia. Next type of local anesthetic is surface anesthesia. So surface anesthesia is nothing but a local anesthetic which is used to numb any surface of our body part. That is nothing but surface anesthesia. So usually the intact skin will be applied with a utentic mixture of local anesthetics. The absorption rate will be slow when compared to the other methods. The third and last type of the local anesthetics are regional anesthetics. And these regional anesthetics, depending upon the region where the anesthesia is given, they are subclassified into various types like nerve block, intravenous, extradural, and intrathecal block or spinal anesthesia. So the first type of regional anesthetic is conduction block. So here we will inject the nerve to a nerve. Basically, all the nerves there will be grouped as a trunk. So in the conduction block we will give the local anesthetic to a trunk so that whatever the supplied nerves are there to that particular trunk, they will be having the anesthetized effect for a period of time. The second type is intravenous administration of a local anesthetic, which is given to the veins. So here 0.5 to 1% of lidocaine will be given without adrenaline. It gives the effect very fastly. Extradural or epidural local anesthesia. Here, as the name indicates, epidural, the injection or a local anesthetic will be given into the epidural spaces of the spinal cord. It may be with the thoracic, lumbar or the sacral. This epidural anesthetic will act on the nerve roots. It doesn't develop any hypotension. Spinal anesthesia, which is also called as spinal block. So here it is a type of regional anesthetic. The injection of local anesthetic will be given into a subarachnoid space with a fine needle, usually of 9 centimeters length. So it is safe and effective form of anesthesia which will cause the sympathetic nerve block. Coming to the complications of spinal anesthesia, it may develop respiratory analysis, hypotension, headache, quada equina, which is a neurological syndrome which developed because of a damage of nerves at the end of a spinal cord, which may result in the prolonged loss of control over the bladder and bowel sphincter. It may develop septic meningitis, nausea, and vomiting. Coming to the advantages of spinal anesthetic, it is safe to use, it produces good analgesic action without the loss of consciousness, and even we can use them in the cardiac, pulmonary, and renal failure patients also. It doesn't cause any problems.